A lot of people have had bad experiences in psychotherapy, and I think there are many reasons for that, but often psychotherapy won't be kind of correctly attuned to the needs of the person. And then here, what's coming up for me is so most people that need psychotherapy are going to have like resistance to psychotherapy itself. Like, for example, somebody with dismissing attachment will feel like, oh, I can't present my upset to the therapist. And so let's say a therapist that's maybe not as attuned or maybe who hasn't done their own work might respond to that with putting pressure, like, no, 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 go ahead and accept this, like, go ahead and take this in, like, let's move through this. But I think that that's not the best way to go about it. Rather, for example, this resistance of like, no, I can't take in care, that needs to be seen and validated. And it needs to be, in my opinion, seen as functional, maybe not currently in your adult life, but that it was functional in childhood, because presenting needs may have made things worse in childhood. So if you like profoundly learned presenting needs will make things less secure, will actually endanger me, then how in the hell would you present your upset, your needs, and so forth to the therapist? It will seem unsafe, even though, okay, that's not logical, but I don't think like a frame of rational and logical is that helpful in this situation. So optimally, the therapist will see this kind of discomfort with taking in care or the discomfort with the client presenting negative affect, and then will be curious about that resistance. And then will like first show like acceptance of the resistance. They won't take the resistance personally. And then they'll, through this curiosity and this kind of investigative exploratory lens, help the client understand and work through their resistance, and honestly like see it as a very valuable and necessary coping mechanism from childhood.